Alright, so on to the next video, which we get to discuss. We'll talk about what is a tabletop test. Tabletop test. So tabletop test is basically, I think it's done for all those hand contractures. Alright, where you ask the person to put their hand on a table flat like this, and because there's a contracture, they are not able to put their hand flat, but rather, okay, there's a space down here, so it's usually done for what? Dupuytren's. Okay, Dupuytren's contracture. Okay, of course, somebody having this contracture cannot be able to put their hand flat on a table, right? So Dupuytren's contracture, just so we say, is a condition where the palmar fascia thickens and shortens. It will now cause fingers to bend towards the palm. So tabletop test checks whether what the patient can place their hand flat on a table. So how is it performed? You ask the patient to place their hand palm that's down on the flat surface like a table. So observe whether all their fingers can fully extend and touch the surface. Okay, so interpretation: if it is negative, the hands lie flat, that means there's no issue. Okay, all the fingers are touching the table, shows you that there's no contracture. If it is positive, okay, there will be gap between the fingertips and the table, and that indicates that there's a Dupuytren's contracture. Okay, so clinical importance is actually simple. It's a quick screening tool for Dupuytren's disease. Also helps determine severity and functional limitations. It's often used to decide if surgeries will be needed, like all those fasciectomy will be needed.